Good morning, everyone. This is Dr. Harrington. This is going to be a brief module on advanced care planning at UAMS, and I hope that it's a practical one so we can improve advanced directive completion and advanced care planning here. Okay, so advanced care planning is important. We know that better advanced care planning outside of a crisis situation leads to more patient-centered care and care consistent with patients' wishes. Advanced care planning is something that everybody should do, even people that are not sick, especially healthy people. It is particularly important for those with a life-limiting disease. And social work and care management should lead the way in changing the culture here at UAMS, where this is just standard of care. We really do need to improve our advanced care planning at UAMS and increase the rates of advanced directive completion. So when I say advanced care planning, what does this include? This can include discussing goals of care and end-of-life wishes, discussing the benefits and burdens of life support near the end of life, things like code status, mechanical ventilations, and interventions like dialysis, defibrillators, feeding tubes, etc. What we want to focus on this module is completing an advanced directive, healthcare power of attorney and or a living will. And then we're going to touch on post and out of hospital DNR forms. All right, so when I say advanced directive, what do we mean? So an advanced directive can be one or both of the following: a healthcare power of attorney and a living will. So if a patient says, I have an advanced directive, and they hand you a healthcare power of attorney form, that is correct. A healthcare power of attorney form is considered an advanced directive. If they hand you a living will, also considered an advanced directive. If they hand you both, great, even better. But both of these forms need to be uploaded into our medical record system under the heading of advanced directives. All right, so let's talk about a healthcare power of attorney. A healthcare power of attorney can be completed, the form can be completed by a competent adult. And this is who the patient wants making medical decisions for them when they can't make medical decisions for themselves. This only goes into effect when a patient loses capacity. So again, competent adult, they name who they want their healthcare power of attorney to be, and it only goes into effect when they can no longer make decisions for themselves. What we like to do is ask for a first choice and a second choice if the first one is not available or able to make decisions. In a healthcare power of attorney form, the patient with capacity must sign the form. It has to have two witnesses, or it can be notarized. It doesn't have to be both. So witnesses cannot be the patient's healthcare provider, cannot be the named healthcare power of attorney, and cannot be someone who could financially benefit from their death, though all of this is in Arkansas law. It's a little vague in the law because it says it can't be a person who's part of the healthcare team. Definitely not the doctor. I would avoid the patient's bedside nurse. But for example, in our clinic, when a patient fills out an advanced directive, we grab a nurse from the neighboring clinic to be a witness, and the front desk clerk can also be a witness. But we try not to have the doctor or the nurse or the patient's social worker to be a witness. All right, can a patient change their mind? Certainly. And that would be voiding if the form is complete. And then also new in Arkansas law, the healthcare power of attorney is void if the patient names their spouse and then they subsequently get divorced or legally separated. Now, after a divorce or legal separation, the patient with capacity can name their ex-spouse. That's perfectly fine. But if the patient was married at the time of completing the form and named their spouse as their healthcare power of attorney, and then they subsequently get divorced, that healthcare power of attorney is null and void. So just be aware of that. All right, so this is what our UAMS durable power of attorney for healthcare looks like. This was created a few years ago. It is, uh, we're able to read on a second grade level. This is very easy for patients to understand. So the healthcare power of attorney form, you have a first choice and you have a next choice, and then a place for the patient to sign the document. And there's witness 1 and witness 2. And if you flip it on the back, it has the notary form, or the notary blank, if you choose to go that way. Again, 2 witnesses or a notary, it doesn't have to be both. Okay, the next part of an advance directive is the living will. So this is what patients want and don't want if they lose capacity in certain circumstances. Again, this is not an order, it is a useful guide. Usually we only reference these when a medical condition is irreversible, if the patient is at the end of life, if life support and interventions would only prolong their death, if they have an irreversible neurological state where the patient can't interact with their environment. So for example, a persistent vegetative state. So again, it's only if the patient loses capacity and in very narrow circumstances. And the reason I put this one in here, it is not an order. If I handed my advance directive to an EMS provider and it said DNR on my advance directive, EMS can do nothing with that because it's not a medical order from a doctor. Okay. All right, so we'll go over POLST and why DNR forms are important a little bit later. Okay, so here's what the advance directive form looks like at UAMS. It has the living will portion. So it says, my living will, has some instructions here, very simple instructions. And then we look at 2 situations. What care do you want if you become so sick that you are likely to die soon? And there are 4 boxes. Can check, I want my doctors to do everything medically reasonable to keep me alive. I do not want life support treatment. If it has been started, I want it stopped so I die a natural death. Or I want my doctors and the person I've chosen as my healthcare agent to discuss and decide what's best for me on every issue. And then there's a place for some specific wishes. Some patients will write in here, under no circumstances would I want a feeding tube. So anything that the patient wants to write, they certainly can. I can tell you if a patient is really unsure about which box to check, I always recommend that they check this 3rd box, right? Because that's the one that has a lot of latitude. The second situation, what would you do if you're not expected to recover from a severe brain injury? And we define that over here. Things like being in a coma or in a vegetative state that you will not come out of, or having end-stage dementia. Again, same 4 boxes. On the back of the form, there's a step 3, which is a lot more space to write in specific request. Again, the patient with capacity signs and dates, 2 witnesses, or a notary. There are a lot of advance directives out there that are legal and acceptable in the state of Arkansas. So while the UAMS one is really fantastic, if a patient comes in with something like 5 wishes or any number of advance directives that you can get at a lawyer's office or download from the internet, these are acceptable as well. So what's the role of social work in case management? Absolutely, social work and case management can talk to patients about the importance of completing advance directive, answering questions about the advance directive, clarifying the advance directive during the admission, making sure there are no changes. They can explain the forms to the patients and can collect the completed form, inform the medical team, and make sure it's scanned into the right place. Again, this should be uploaded into the electronic medical record under the heading Advance Directive. What I would recommend against is just handing the sheet of paper to the patient and walking away. Okay, this really does require some explanation and answering questions and helping the patient if they have any needs. All right, so a couple of tips. If the patient brings a completed advance directive to the team, the first thing you do is you check that it's signed and witnessed or notarized properly prior to faxing it to medical records. We've had some incidences where the advance directive is uploaded into Epic and it's not signed. Well, I can't do a whole lot with that. So always make sure that it is completed appropriately. When talking to patients, it's really important to normalize completing an advance directive. No, this does not mean you're dying. No, this doesn't mean that you've been diagnosed with something that we're not telling you about. This is standard of care. Everybody should have an advance directive. Even healthy patients, and emphasize that the healthcare power of attorney makes medical decisions if the patient does not have capacity, and the living will is only considered in circumstances described in the document. This is one of the most misunderstood things. So some patients think, well, if I sign this right now, I've just my choices are taken away from me. No, that's not what it means. Patients with capacity, we will absolutely talk to the patient about goals of care and making medical decisions. This is only for when patients lose capacity do we look to the healthcare power of attorney, and this is only in some narrow circumstances that we look to the living will for medical decision making. And I always describe it to patients as it's a gift to your loved one. All right, so let's talk about this form, a portable DNR form. Some people will call it an out-of-hospital DNR. At the VA, we call it a SAPO because it's a state-authorized portable order, or an ambulance DNR. And this is a form that EMS will honor inside the ambulance, at home if the EMS is called to the patient's home, or if they're called to the nursing home. Again, this is more of an EMS form. This is what it looks like. Okay, so it has the patient's name, the signature of the patient with capacity, or the healthcare proxy or legal guardian, and then the date. And then here it says attending physician's order. It doesn't necessarily mean the attending physician like we think about in an academic medical center. Arkansas law really didn't define attending physician, only the physician who is responsible for caring for the patient. So I think as long as the physician has an Arkansas license, a resident could sign this. If they have an Arkansas license, Pallet of Care attending could sign it. The patient's hospitalist can sign it. So I think there's some latitude there. Signature of the physician, printed name, the physician's telephone number, and the date. And again, I would recommend this being a telephone number that is close to the physician, because this is really if EMS has any questions. So I usually put my cell phone here. So let's talk about a POLST. A POLST is a physician order for life-sustaining treatment. And this is a portable medical order form used to record a patient's treatment wishes that can be used across settings of care, where the portable DNR form is really for the EMS, right? It's an EMS form. This, a PULSE form can be used across all settings of care and is portable. So a PULSE form has a code status order, and it goes on to have what the patient would want as far as medical interventions. Do they want full court press? Do they want limited medical interventions, or comfort care only at the end of life? And then there's a place for some additional orders. This form can only be filled out by a physician with an Arkansas license, an Arkansas POLST, and it has to be a face-to-face discussion, either with the patient or the surrogate if a patient does not have capacity. Has to be completed together. This is not a form that you hand the patient and say, bring this home and bring it back, like you can with an advance directive. A PULSE form is intended to be used by individuals with a serious illness or frailty towards the end of life. It's really for patients for whom the physician thinks has a life expectancy of less than 1 year. And it can be completed by a patient with capacity or their legal surrogate. So just to compare the two, so we're all on the same page. Remember, an advance directive, it's for everybody. All adults should have an advance directive. An advance directive provides instructions for future treatment. It appoints a healthcare power of attorney. It can only be completed by a patient with capacity. It does not guide emergency personnel. It's not a set of orders. It guides inpatient treatment decisions when made available. A POST is for a very narrow subset of patients. This is for patients with a very serious illness who we think have less than a year to live. This provides medical orders for current treatment, and this one can be completed by a patient with capacity or a surrogate. A POST form is honored by emergency personnel, and it guides inpatient treatment decisions when made available. Here's what it looks like. It's hot pink, and a copy is valid too. So if a patient brings a copy of their original pulse, that is perfectly fine. So just to let you know, this patient's last name, first name, middle name, date performed, patient's date of birth. Part A is CPR preferences. Part B is medical interventions. And then Part C is, again, any additional orders. So things like artificial hydration and nutrition, dialysis, those kind of things. And then this is what the physician fills out. The physician really fills out the whole thing. It's discussed with the patient or the legal representative. We show that we've reviewed the advance directive, physician's name, signature, phone number, license number, and date, and this is where the patient or the legal representative signs. Okay, so how do I know if a patient has an advance directive or a pulse? Can we look in the electronic medical record and figure that out? So I'm going to show some screenshots. One place that you can look is the banner. So I've blacked out names. So in the banner on the left-hand side of the Epic, you can see the patient's code status. And here it says no ACP doc. So if the patient had an advance directive, this is where it would show up. So at least if they do, it's not uploaded in the right place. So if the advance directive is uploaded in the correct place, it will show up here as has advanced care planning docs. Pulsed, yes, this patient does have a pulsed. So you can look on the banner for kind of a quick access. Here's some other ones, right? This patient is full code. This patient does have an advance directive. They have a healthcare agent. So in the advanced care planning tab, the physician has identified who the decision maker is, and that will show up on the summary sheet as well. And then this patient does not have a pulse. Here's one where the code status is DNR. They do not have an advance directive. They do have an active healthcare agent. They do not have a pulse. So again, you can look at the banner first. The next place you can look is the Advanced Care Planning tab. If you don't have this as one of your favorites, go ahead and just put it up there. That way it'll be there for every patient. And if you scroll down the Advanced Care Planning tab, it'll have the patient's current code status. You can look at all the previous code status orders and their previous admissions. And then under Documents, Advanced Care Planning Documents, a advanced directive will show up here, a pulse will show up there as well. The last place that you can find an advanced care planning document is under the Media tab. So if you go under Chart Review and then go to Media, the nice thing is, instead of having to just comb through hundreds of documents under the Media tab, we have some filters. We have an advanced directive filter and a pulsed filter. Okay, so if you click on one of those and the patient does have an advanced directive or a pulse, it will pop up right here, so you don't have to look for it. Okay, so the next question is, where do I find these forms and how do I upload them into the electronic medical record? So, and I'm going to go through the steps as well. So you go to Forms on Demand. Okay, and you can download the documents, print them out, and bring them to the patient. I would highly recommend that in each social work or care management office, you just have a giant stack of them. That way you don't have to do this every time. Once the patient fills it out, they'll get the original. Make sure the patient gets their original, and then you'll make a copy, and then you'll fax the copy to medical records. Please, please, please do not place this in the giant pile of papers to be sent down to medical records. 50% of the time it just gets lost or it's uploaded as another title and then we can't find it. So we've created two fax cover sheets. One is an advanced directive fax cover sheet. The other is a pulsed fax cover sheet. So what you do is you fax, use the cover sheet and fax the documents to medical records. Those should be uploaded within a few hours, okay? And then make sure that it's actually been uploaded to the right spot. Do a follow-up for that. Okay, I'm gonna share my screen. We're gonna go through this. Okay, so if you go to the intranet, this is pretty easy, and go to Clinical Desktop and Forms on Demand, and you'll enter your email address to get in. And we've made it really easy. There is one folder with all of the advanced care planning documents in it right here. Okay, so what is in this folder? Right here is the UAMS Advanced Directive. You click on that and it will bring it up and you can download it and print it. The first page, front and back, are frequently asked questions, kind of what is an advanced directive, who should have one, how do I set it up. This is really easy, and sometimes if you just want to go over this with the patients, that can be really helpful. So that's front and back. And then here's your power of attorney for healthcare, that's front and back, and then living will, front and back. Okay, so there's your packet for the UAMS Advanced Directive, also in Spanish. There we go. Okay, so you've got your English version and your Spanish version. Here is your advanced directive fax cover sheet. Again, social work and case management, just print out a bunch of these and just have them in your office. This is the fax cover sheet that you use for the advanced directive. Now, if you work at PRI, they have a very specific psychiatric advanced directive, but most everyone is going to be checking this box. And then put the patient's label right there, and then you can fax it to medical records. And here's the pulsed fax cover sheet. If the doctor hands you a copy of the pulse, this is what you use. Again, this can only be used for the pulse, attach the patient label, fax it down to medical records. The other thing that you may want to do is print this out. These are document labels, just in some little sticky labels. So if a patient brings you in an outside advanced directive, like a 5 wishes or something that's not UAMS driven, and you'll need a little barcode on it. Does it have to have this? No, but this is just another way to ensure it gets to the right place. All right, ambulance DNR form right here. Okay, so you can download that. And then here's your pulsed in a PDF version. Again, this isn't the this is perfectly acceptable. It doesn't have to be on hot pink paper, but we've got a stack of those also. So if a physician is needing some help with that, you can always download that and hand that to the physician. So just to review, if EMS is coming to pick up your patient to bring them home with hospice or to an inpatient hospice, the family wants them to be DNR in the ambulance, the EMS folks need either the ambulance DNR or the pulsed. Either one is perfectly acceptable. What is not acceptable is printing out the DNR order from Epic and handing it to EMS. Not really a legal thing. So either the ambulance DNR or the pulse form, both are acceptable. All right, we're going to go back. Okay. So just a reminder, I'm going to put a Pallet of Care plug in here. If you are on the team taking care of a patient with any of these things, please suggest to the primary team, could this patient use a Pallet of Care consult? they have a terminal diagnosis or a poor prognosis. We're trying to teach some of the trainees the "Would you be surprised?" question, which is quite accurate, believe it or not. So, would you be surprised if this patient died within the next year? And if your gut says no, I would not be surprised, that is really a trigger to have some goals of care discussions. Um, is this a patient that's had multiple admissions for the same end-stage disease? Complex symptom needs? Do they need some more help with advanced care planning and goals of care? Are they hospice eligible? Do they need a referral? And then are they dying in the hospital? Do they need an extra layer of support from the palliative care team? All right, in conclusion, discussing advanced care planning forms with patients is really important. Social work and care management can help improve advanced directive completion at UAMS. Check for advanced directives or PULSE that are already uploaded into Epic, and please inform the team if they're already present. Sometimes the doctors just miss these, and these are really important to know what they say. Be ready to discuss advanced directives and answer questions from patients. Use the advanced directive or pulsed fax cover sheets to ensure the correct upload into medical records. Ambulance DNR forms or pulsed forms are acceptable documents for EMS and discharge, but pulsed is preferable if they're transferring to another setting. All right, that should be it. Please don't hesitate to call Palliative Care with any questions. We're happy to help. All right, thank you very much.